So one of the important ingredients here is that you guys have never experienced a disaster like this. So bringing in experts that have done this work who can say, here are things that you guys need to consider. Second, what resources have been used in other communities, and what will work here. So what's going to work in your elementary will not work in your high school, but we have those options. So I'm what's part of what's called the National Child Traumatic Stress Network. I'm at the UCLA, the Duke National Center. So we coordinate 199 funded centers that are focused on child trauma. So we have programs and people that have worked with the adolescents, that work with the kindergartens on under. And so part of this is, how do we create a program that will work now and into the future? So in this early days, is there psychoeducational materials on both grief and trauma that are culturally appropriate for your diverse needs, that are have given scripts of how to talk to the young first graders or the second graders who might have questions that your educators might have? The high schoolers will have different questions, so we want to give different supports. So what we try to do is, first and foremost, thinking about your tiers of interventions that we do in schools. What's those broad-based tier one interventions? So are we making sure we're providing psychoeducation? Are we providing wellness initiatives? Are we providing those additional supports, whether it's even making sure that people are able to meet their basic needs? We're thinking of those things that we're hearing about, of childcare, busing. All those things are absolutely essential. The other piece, and second step, which is in some of your schools, that's a tier one intervention. We know that there are going to be both staff and students who are going to experience moderate PTSD or grief that are going to want services in schools. And so there are interventions that can be done in schools. And some may choose to get their services in the community. So there's going to be additional training and support in mental health providers in the community. We need to make sure that your school systems are aware of what's going to be happening or the opportunities and having that linkage. So a school-based recovery program has to include a team for staff and a team for students, because staff don't want to see the same clinicians or the same support as a student just walked up by. So we're going to need to be thinking about, how do we provide those supports for your staff? And many have told me over the years, you can't expect me to do this after hours or frankly on the weekends. I'm exhausted. I have to rebuild things. So what systems or programs can we do in school? Which also may mean what additional supports, so that educator, especially if they're in the classroom, have that ability to take that moment to actually utilize them. But then we also need to have those programs for your students. And linking with your community partners, are there programs for your parents out there, or can we offer some of those? And that sometimes that's offered in the community, and sometimes we can do that too, or sometimes we can do that training. But we know kids do better when the adults in their lives are doing better. And so that's why there has to be, for a recovery program, strengthening your educators in this, their parents, and their kids.
Listening to all this sounds great, but it always comes down to, just like filling teaching positions, like, do we have the people with expertise in Hawaii? And it sounds like we're going to need to bring in a lot of experts.
There are times that I was Sandy Hook. I was the lead advisor to Newtown school districts, and we had to create a program for the entire district. Even though it was Connecticut, people would have probably thought we had enough mental health. We didn't have the right mental health. So there had to be a period of time that we had to bring in additional supports. Those community supports, as we were training the school-based teams to do this work, we had to have those extras. But over time, when those were no longer needed, they left. And then we supported those school-based services further until they didn't need us anymore. So there may be needing additional supports, and that's why working with your mental health, you have the Hawaiian Psychological Association, you have your the Hawaiian adolescent and child psychiatrist teams. All of them are folks that we coordinate with. There's so much wealth of talent out there. Let's coordinate it together. Let's make sure they're trained for this specific incident, and that that we partner together to get these needs met.
Thank you for sharing all that expertise. Is there anything else you'd like to add?
I know that we want it done right now, but hearing everyone's voices beginning to work together, and there's not a one size fits all. So these plans only work when we partner together, and that's including your youth's voices, including your parent voices, and you as educators. So some of these approaches are, here's some options. Let's work together of what will work here, and that's the critical part of making this successful. You guys already have the heart. You know what works for your community. Let's make sure we build an infrastructure to support your community.